All right, so let's do a little bit of GI and GU system. So gastrointestinal, GI, genitourinary system. Here we have the esophagus. As food is chewed up in the oral cavity, it's broken down. There's some digestive juices, up in the oral cavity. And we swallow, it goes down peristaltic motion, one way down through the esophagus. Ends up in this very acidic content in the stomach, where it continues to get broken down. There are more enzymes that, as it passes from the stomach and into the small intestines, there are some enzymes from the gallbladder here that's under the liver that share this pathway, common bile duct, and some digestive exocrine gland stuff from the pancreas that spill it over into the small intestine just as it empties from the stomach, that help to continue to break down the products of digestion. And then it enters into the small intestines, where a lot of the nutrients and water nutrients is absorbed into the bloodstream, and it funnels down into down here, this area where we have the appendix, and we start to transition into the ascending colon, transverse colon, and the descending colon, and the large intestines. And this is where the water is reabsorbed. So this is the gastrointestinal system. Genitourinary system. So overabundance of water in the bloodstream is then excreted through the kidney. The kidney filters out water and some of the byproducts of metabolism. And this water then accumulates through this collecting duct. This is called the ureters. We have two kidneys, the right and the left. And it comes down the ureters down into another pool or a vessel that holds it, called a cyst or the bladder. And then it's excreted through the urethra. Some of the medical emergencies that we would then decide to put up in this category here, let's start off with maybe something called like a GI bleed. There's a lower GI bleed and an upper GI bleed. But the upper GI bleed, would be up here, UGIB, abbreviated, or an arrow, GIB, upper GI bleed, defined as a bleeding that's somewhere in the stomach as a result of some type of ulceration that caused the wearing out of that stomach lining. It's now we have active bleeding that goes on. The person that might develop this would be somebody that maybe takes a lot of aspirin, or maybe has some kind of bleeding disorder, or somebody that might also have peptic ulcer disease, H. pylori. So this wears out and causes more bleeding, and because this highly acidic content in the stomach, it starts to wear away, and we have a lot of bleeding that goes on. So what we would define now is that we would see the signs. What would we see? Our patient might be pale, cool, and diaphoretic, and as a result of this blood that's accumulating in the stomach, it's getting digested. And so they'll feel sick to their stomach, they'll complain of the pain, that would be history, but what we would see is the vomiting of the blood, hematemesis, which usually, because it's digested from the acidic content in the stomach, turns into coffee ground material, black, if you will. And so I'll tell a lot of patients, to take a look at your stethoscope. Is it this kind of dark black in color, and is it tarry? Well, that's for stool side, but is it black when it came out? Coffee groundish. As this blood continues down through the intestines, both small and large, as it's defecated and purged out through the rectum and the anus, we'll note that they have black tarry stool. Again, it's a black color, very thick. It's hard, and it has a different smell to it. So they would know that it's not a normal bowel movement per se. So this would be some things that you would see if the toilet, you would see some black tarry stool. You might see them with that hematemesis that vomited out in the toilet or in a bucket or in a bag, and they'd be pale, cool, and diaphoretic because they're losing blood. Now, what else would we see as far as a sign? If it's not bleeding, they might be tachycardic to compensate for blood loss, heart rate increases. They might be a little tachypnic in order to increase oxygenation with that blood loss. They might increase their respiratory rate. Lung sound still would be clear. Right? But now let's go with the symptoms now. They would complain of stomach pain, perhaps, maybe a burning sensation. They feel nauseated. They might feel faint or lightheaded because their blood pressure is low because they're bleeding out. During the history, they might tell you I have peptic ulcer disease. I may be on medications to help me to prevent this from happening, and I might have had a GI bleed in the past. I am vomiting coffee ground material, and my stool has been black and tarry. They may also complain of being faint or had a syncopal episode. So we'd ask the questions, and these would be some of the sample questions that you would want to list as far as the upper GI bleed. And what would we do as BLS providers? High flow oxygen, position of comfort, and get our good set of BLS vital signs. Remember, treat them for shock, keep them supine, loosen restrictive clothing, keep them warm, don't lose any more heat loss. But high flow oxygen as they're losing oxygen carrying capacity or blood. There are many other GI considerations or emergencies. There's gallbladder problems called cholecystitis. There is intestinal and stomach problems like food poisoning, where they're vomiting up blood, vomiting up foodstuffs, or there's gastritis, where they're vomiting up stuff, and it could be diarrhea, where it's coming out on the lower end. So it's enteritis. So there are many different other things that we need to think about as far as the GI system and what we need to look for. Urinary system. One of the common ones is maybe a urinary tract infection, where they complain of increased retention. The bladder always feels full, like they haven't emptied it all, and they gotta urinate all the time. There may also be some hematuria or blood in the urine, and it may be a little painful when they urinate. So that's cystitis. If this infection travels up and affects the kidney, you could have things called pyelonephritis. Other things that we need to go on here as far as our medical emergencies, there might be a kidney stone that you might want to look up. Again, for this genitourinary, it's more of an insidious process. We may end up wondering whether or not this might cause some kind of sepsis, where the infection it overwhelms the body's defense mechanism and is now in the entire bloodstream. But do good BLS measures as far as the urinary side goes, the genitourinary.